I am pleased to introduce one of my co-leads in this effort and tonight's session leader, Reece Fenning. Reece was born and raised in Upland, California. Having grown up near the San Gabriel Mountains, he appreciates nature and unique landscapes. His parents, who were a child welfare social worker and a rehabilitation counselor for adults with disabilities, raised him to have a strong social action and justice framework. He attended UCLA after high school and studied molecular and cell and developmental biology, graduating from the Honors College. While in school, he worked part-time as a teaching assistant while also organizing medical trips with global medical training to serve low-income international communities in rural settings. In medical school, Reece shifted his focus to domestic healthcare issues through his work in health policy education at UCI and obtaining a master's in public health at UCLA. His master's research project was in transition age youth homelessness and substance use, and he completed an internship with Uncommon Good, assisting the development of their low-intensity cognitive behavioral mental health program. Reece matched into family medicine and is excited to open the next chapter in his medical journey. Welcome, Reece.
Thank you, Kelly. Hello, everyone. So today I'm going to be giving a lecture on a needs assessment, and let me share my screen and we can all get started. All right. So for today's talk on introduction to do needs assessment, I didn't want to make this too technical, but I also wanted to make it very practical and really try to drive home to everyone that simply by being in a research-driven degree in undergrad or skills that you get in your professional school or during medical school, you have a lot of the skills needed to do a needs assessment. A lot of it is framed around doing a very thorough and good literary review. And then after that, it's about really digging down a little bit deeper and getting involved in the community. But before I get into how to really get that information, I wanted to spend some time talking about some of the different approaches that you can take in terms of developing these interventions for the communities that you want to make change in. And then also talk about a couple of important theoretical frameworks to really try to frame and think about some of the issues and the problems that we want to try to address or do more research with a needs assessment. So first, when we think about approaches and research, there's two kind of fundamental camps. For a very long time, we had this top-down model, and this was kind of how traditional research was done, where you'd have the researcher come in and tell a community what some of their problems are, design an intervention for them, but they weren't necessarily getting a lot of that collaborativeness and community engagement involved. Not to necessarily ding it, but more recently, there's been more of a bottom-up approach where you really focus more on developing grassroots coalition building and partner with people in the community in order to make the change that you want to make. There are pros and cons to both fundamental camps. And really, in terms of choosing which one you want to do is going to be very much project specific and situation specific as well. Some of the, I would say, benefits to doing a more traditional approach would be that it's generally more easier to replicate. It can be a little bit more structured in terms of your scientific approach. Just because there tends to be less people kind of contributing to the direction. But that in its sense is part of some of the negative aspects to it. There's also a obvious imbalance when it comes to power dynamic between you/your team and the community that you're trying to affect change in. And it may not be necessarily what the community wants most, because you're not necessarily getting all of their input. In terms of more of a grassroots approach, the obvious benefits to it is that you have a more democratic sort of process. You're focusing more on building capacity and redistributing power to the community for them to make the decisions as a group in terms of what are some of the problems they want to address. This sort of approach may not totally be what you want if you are limited on time, because when you are including a lot of people into the decision making, that can sometimes make things go a little bit slower. And additionally, it's very difficult to replicate some of these studies. This last bullet point where it says outcomes may become fuzzy, disregard that one. If you have a good partnership with your community and you develop a good framework for your needs assessment, your study, that should never be an issue. So we've kind of talked about the two fundamental approaches to engaging in community. Now I kind of want to talk about a couple of different logic models that we use in order to think about a lot of our problems that we want to make changes in the community. And this first one is a very common framework in public health. It's called the precede proceed model. And the reason why it's important to frame a lot of your thinking into these logic models is because it allows you to not get totally lost into your problem. It gives you a structure to not only think about your health problem that you're looking at, but also it gives you a structure in terms of what are the possible points of influence that you can have, as well as also obvious like points of conflict or points that you can have making an intervention or types of interventions. So in particular, for a needs assessment, you're really looking at phases 1 through 4. And I'm going to take out my little handy laser pointer. Can everyone see this on the screen? All right. So phases 1 through 4, this is going to essentially be this red box right here. And this is what our needs assessment is really going to be getting into. For phase 1, for this social assessment, this is going to really be important in terms of developing a partnership with your community. This is really about looking at the concerns that are perceived in your community. And this really involves community engagement and involvement. Number 2, for the epidemiological assessment, this kind of gets into this like second row right here, which is genetics, behavior, and environment. Those are, I think, very common. I don't necessarily need to define those, but something that I do want to point out when we were looking at this sort of framework is we should pay attention to these arrows. And with any sort of framework, we're going to have certain assumptions that we're making. And these arrows are kind of our assumptions. We're assuming that behavior and genetics and environment do play into health and are part of essentially like the multiple factors that play into health. We're also assuming that health is very instrumental in terms of the metric that we're looking into, which in this case is quality of life, but it could be whatever our health problem is. And then something that we're not going to necessarily get into, but another important assumption that this graph makes is that evaluation is important, planned, and something that's continuously ongoing, but that's not necessarily something that we're going to get into for our needs assessment today. Now for this third phase, which is the educational and ecological assessment, we have predisposing, reinforcing, and enabling factors. I think these can be like sometimes a little bit tricky to tease out in terms of what their like the lineage is. So for predisposing factors, that's really going to be kind of like the attitudes or beliefs or values that predispose the certain behavior that essentially leads to our health outcome. Now, it's important to note too that genetics can be a predisposing factor, but notice that this predisposing factor doesn't influence genetics. Additionally, for reinforcing factors, this is really going to be something that has a consequence. It could be a positive or negative consequence, but that's essentially going to lead up to the health behavior that we're really looking into. And then lastly, we have enabling factors. And this is going to be kind of part of a little bit of like an environmental ecological assessment in terms of what is available and accessible that leads to this behavior, whether good or bad. And this includes, this could also include barriers too. And that's the part of why we see enabling as being a direct link to environment as well. And then lastly, in stage 4, we have administrative and policy assessment and an intervention alignment. So here we're really thinking about what policies, or if there are any policies that can reduce or promote the health problem or behavior that we're looking at. So I think it's very important to kind of have this framework in mind when we're thinking about interventions and we're thinking about like the purpose of our needs assessment for the health problem that we're looking at. Next, I'd like to talk about, this is called the Socio Ecological model. It's another very common framework that we use in public health. And it's used to really describe this multifaceted nature of how our society is structured and how this can affect health. So at our baseline level, we have the individual. This is also called the intrapersonal level. Here we're going to be really dealing about a person's personal knowledge or attitudes or skills. And to give some like a little bit more context and what I mean by this, I'm also going to lead us into an example as well as I go through each level. So let's say if the health problem that we're looking at using the socio-ecological model is diabetes. An issue that we could run into on an individual level could be that that person's never heard of diabetes before, or they don't have a lot of health knowledge about diabetes. Another issue that we could run into is maybe they know about diabetes and they just don't think it's that bad. And they think that a lot of the complications that we see, that it's not going to happen to them. Or another thing is that they may have a belief where if they take medication for their diabetes, it may cause some negative side effects, such as them like losing a limb. And those are a lot of common opinions that we run across in a clinical setting that we often have to combat and really try to educate our patients in. Now, on an interpersonal level, this is when we're looking at more of a peer social network sort of framework. So this is going to be like on a family unit sort of level. If we apply it to our problem of diabetes, maybe this person comes from a family that just eats a lot of high carbohydrate foods and they eat a lot of sugar, and that person's not necessarily cooking a lot for themselves. So that could be another contributing factor that's causing their diabetes. On an organizational level, here we're thinking about like social institution, workplaces. Maybe this person has a desk job and they're not able to, or they're not allowed to have too many breaks to walk around. Maybe the cafeteria that their workplace provides has a lot of high carbohydrate foods, which forces them to have to bring in their food, and they don't have the time to prepare it during the week because they're working 3 different jobs or something. Additionally, maybe the employer didn't provide healthcare, so they've maybe could have prevented their diabetes from manifesting to begin with. So these are kind of different tiers that may influence the health problem that we're looking at. And then lastly, we have a community and public policy levels, which are a little bit larger framework. But on a community level, this person could also live in a food desert and may not have access to very many grocery stores. So when they go to a liquor store, maybe there's just not a lot of fresh foods for them to eat. Additionally, on a public policy level, maybe that state or that county doesn't support diabetes prevention programs, or the legislation's not aware of how big of an epidemic it is in their neighborhood. So these are basically I tried to describe regarding diabetes, how these different levels of influence can essentially influence our problem. And it's important to keep these levels in mind when we're doing a needs assessment, because we're going to have to look at each one of them in terms of potentially being problems that lead or are causal for the health problem that we're looking at. And then next, I want to talk to a little bit about what is the importance of conducting a needs assessment. And really, when we're conducting a needs assessment, this is going to identify to us the what, the where, and potentially even the how and the why, in terms of the causes, or even the metrics related to our health problem. So first, you want to identify like where the health problem is most prevalent. Maybe you don't have prevalence data, and that's something that you are going to have to come up with through a survey or mining through different health databases. You could also need to identify what groups of people are most involved or most hurt by your health problem. And then also identify what risk and protective factors there are. And then essentially, something that I also want to really reinforce here at the bottom of of all of this is that the whole goal is, as you're doing this, you're also developing support and stakeholder buy-in, which is going to be really, really important when you do eventually want to make an intervention. Or if your intervention is completing a needs assessment, which has never been done for the community or group of people that you're looking at, if it's on a more international basis or micro level. And the key here is trying to form a baseline of data which you can monitor change over time. That in and of itself is probably the most important thing that can come out of the needs assessment when you're looking at an intervention, is that you need to have a sort of baseline to be able to determine whether or not your intervention is really making a significant difference within your community or not. So next, I want to go into kind of the general structure to a problem statement that essentially allows you to structure your needs assessment, but also structure the intervention that you want to do. So the general structure to a problem statement, that you need to define the health problem, you need to describe the population. And this is going to have to be done in a very short and concise manner. Typically, for most program proposals, you're given anywhere from half a page to 2 pages. 2 pages is probably a lot. You're probably going to be looking at really one succinct paragraph that explains your health problem, issue of or the issue for your research or intervention. I want to really try to drive home the point that this is not supposed to be something that's really easy. Often we save this problem statement for the last part in terms of making a program proposal that includes potential needs assessment that you've conducted and an intervention that you'd like to do to help a certain group of people. And the reason why it's the last is it's kind of similar to an abstract of a research paper where you're basically summarizing everything that's about to come forth next. You want to demonstrate significance and define the problem. When you're defining the problem, it's really important to identify the what, who, why, and how this problem is manifested. And then it's also important to include the all-important but statement, which is showing that there's an unmet need. I would say if there's a most common problem that I have seen in people's or community-based organizations, problem statements or mission statements, it's forgetting to state what the unmet need is. They do a great job of describing what their problem statement is. They do a great job of also describing their target population, but they forget to describe the unmet need. And that unmet need is going to be very, very crucial in terms of really showing definitive significance for the context of your program proposal. Next, when you're defining, so in terms of the basic components of defining the problem and the population description, you want to really describe what the health issue is, the current state of resources and interventions that are used to address it, and some of the people that are left out. And this is done on more of a generalized basis. This isn't necessarily for specifically your target population. When you introduce your target population, that's when you can intertwine the two. So you need some generalizability, and then you need to really zero in and focus more on your target population in terms of what are the environment in which your target population is in. So when you're describing your target population, it's also important to keep in mind of all of the other people that may be influenced. This includes stakeholders and indirect targets. I think a good example of this is if you're going to try to address really any childhood sort of health problem, you're going to end up engaging adults as well. This could be parents, this could be guardians, this could be people in a school district, things of that nature. So in these sort of situations, even though children may be your direct target that you want your like end outcomes to measure, really your direct target is actually going to most likely be the adults involved in their care that kind of determine the rest of their environment and social situations. And while you're doing this description, it's very important to also keep in mind to what I stated earlier in terms of stating that unmet need, which is identifying gaps and barriers that are identified in the needs assessment. Now, part of doing a needs assessment may help close some of those gaps in the information that you have. And that's also important to keep in mind when you're developing an intervention, because maybe the intervention could just be like, this community needs a monitoring system because the local hospitals in this area, that even though there are 3 local hospitals, no one's actually tracking the specific city because it's 30 miles away from any one hospital. So to just kind of recap the last sort of slides that we've gone over, the 3 big components that you're going to be thinking of is that you're going to want to identify your health problem and your target population. You're going to need to describe both of them and the environment. Then you really want to assess issues, problems, and assets. Essentially, it's a community resources sort of perspective. Now, next, I'd like to do a little activity to kind of break up the lecture. And I want us to look at this example problem statement that I pulled from one of my courses during my public health program. And I want to see if you guys can identify the different components to this statement, and then also what is missing. So I'll read it aloud. So approximately 70% of American Indian and Alaskan Native reside in urban areas. National data shows that they report higher rates of alcohol and other drug abuse, greater frequency and intensity of alcohol and other drug abuse, earlier first alcohol or drug abuse, and other high alcohol-related mortality than other racial ethnic groups. Traumatic exposure and family histories of mental health and substance abuse may increase AOD use amongst American Indian and Alaskan Natives. These stressors may increase AOD use due to issues associated with cultural identity, decreased spiritual base, and lack of community cohesion. So what are some of the things that you thought that this statement did well? Do we have anyone in the chat?
I think it clearly identified, no, not yet.
Okay.
But Julie did mention, describes the population / problem well, and I would retweet that it's very clear who you're focused on here.
It's very specific too.
Um,
It identified a baseline, which is pretty important as well, by saying approximately 70% of American Indian and Alaskan Natives reside in these urban areas. What is the one thing that's missing? So I would say that it established our health problem, which is alcohol and other drug abuse. It also established our target population, which y'all had stated. What it's missing is that I'm not sure if we have an unmet need, because it's not stating any of the current resources that are available. And that was on this next point. So despite high alcohol and other drug abuse rates among American Indian and Alaskan Native youth in urban areas, there are few evidence-based, community-informed, and culturally appropriate programs targeting them in urban environments where 70% of the youth reside. So here we've now also just described that they don't have any culturally appropriate resources to address this huge problem within this community. So those three components are so crucial in your introductory statement when trying to address a health problem with a certain intervention. So before I get into some of the components of how to really conduct a needs assessment and gather this sort of information, do we have any questions? If we don't, I'll just keep trucking on through.
yeah, I don't see anything in the chat.
Okie dokie. So what are the methods of collecting information about a community? So if you wanted to learn more about a health problem, what are some of the things that you would go about doing? I think that as a lot of us being healthcare oriented or health majors in undergraduate level, we'd probably all start with some sort of literary search. And that's actually one of the main areas that where you gather information. In terms of whether or not to start to target your primary data sources first versus your secondary data sources first, in my experience, I've primarily started with secondary data before I moved to primary data. And the essence why is because, in particular, when you aren't necessarily the de facto expert or a health problem that you want to try to address, it's important to educate yourself by reading either books or articles or journals related to that health problem. And that essentially gets into sort of our literary search and some of the data that we look at. After you have that sort of grounding into your health problem, that's when you can start to think about your primary data sources, where you may interview some key informants or leadership interviews, do a focus group in the community or a group forum, or even perform a survey. Simultaneously, or you could have done this first, you also want to be looking at health data for your current area, which you can generally find through government agencies, community-based organization, or even like federal agencies that report data amongst different communities. And then clinic and hospital surveys can be very, very important too. Particularly in California, hospitals have a needs assessment component baked into a lot of their operational costs, and they have to do a needs assessment on their communities about every 2 to 3 years at a minimum. So if you're trying to find some health matrices that are very specific to either like one city or a couple different cities, hospitals that publish these results are generally like pretty reliable areas to look for. In terms of your literature review, articles that I typically prioritize are going to be original studies. Then I'll go into reviews or meta-analyses. And here I want to emphasize that for reviews and meta-analyses, it's not that they're necessarily worse than original studies, but what I find that they can be more helpful is that they can help you identify other papers that help both give you a better theoretical framework for some of the causes of your health problem, and also point you to directions of other original studies that may have been groundbreaking for your specific field that you're looking into. Additionally, this kind of first section of looking at kind of the research papers, I find that coupling this with state, county, and city reports is very, very crucial in developing a cohesive argument. Oftentimes, I will prioritize actually finding the state, county, and city reports to a greater extent than the original studies and the reviews, because to me, this is going to be more of your theoretical framework, 1 and 2. And then number 4, this is going to essentially be your database. So this is going to be where you're going to get some of your hard baselines that tell you how big of a problem that you have. Now, let's say if you don't have good baselines available that are provided by your state or county or city, then that's something that you're going to need to do. And that's when we start to look into conducting health surveys and things like that. In terms of online resources, this is typically, I'm referring to like community-based online resources. It's just important to keep in mind that not every community-based organization has the same rigor in terms of how they conduct their surveys or publish information as some of the other review articles or original studies. So it's important that before you use or cite some of their work, speak to them. And typically, if you're finding a group of people that are interested in your health problem enough to have conducted their own survey, could be a good place to start for a key informant interview to kind of gather a little bit more of what their opinions are and some of their methods in terms of how they seek to either address that need or why they are interested in tracking that specific health problem to begin with. And the entire time you're doing this, you're keeping in the back of your mind, how am I demonstrating an unmet need, if there is an unmet need? Now, in terms of more complex assessments, this is where we think about our key informant interviews. So I really want to stress with key informant, this doesn't necessarily mean that you have to look for like the de facto researcher that's most famous for doing research in this field. Oftentimes, talking to someone who's on a more local level that's also investigating or has published similar articles that you've come across can be just as informative, or even more so. I'll give you an example. If you're thinking about addressing substance abuse in a service planning area in LA County, would it be, you could interview a really hoity-toity professor in Chicago who knows a lot about substance use, or you can interview someone who may be at Cal State doing more local research and community-based partnerships and how they're mining information. The local person is actually probably going to be more important for you to speak to as compared to the person who's from Chicago. Now, key informants doesn't just include like professors and researchers. This can also include people who are doing the work in the community. It could be a social worker, it could be a therapist, it could be someone from your target population who's seen as a local leader, whether that's a pastor or just really, I just wanted to stress that key informant doesn't necessarily mean someone from an academic institute. In terms of conducting a survey for your target population, really want to stress this point. You don't need to reinvent the wheel unless you absolutely must. And what I mean by this is that you don't need to develop a brand new survey. Oftentimes, a lot of these public health program or public health problems that we're trying to address is nothing new. It's something that's been known for a very long time. And there are other surveys out there that other people have used and may have a lot of scientific backing for showing its effectiveness that you can apply to your situation. It doesn't necessarily have to be 100% similar or 100% the same, but it's important to keep in mind that you don't necessarily need to create something brand new unless you are looking at something from a new perspective, or you're looking at a health problem that hasn't been tracked before. For example, if you're looking at a health problem in a demographic or population group that hasn't been studied and you want to make the survey culturally appropriate, then your adaptation may just force you to make a brand new survey. And then lastly, for number 3, this is something I don't have a lot of experience in doing, which is a geographic information system mapping, GIS mapping. For anyone who was here last night for Dr. Eiten's really powerful talk, essentially that's a lot of what Dr. Eiten has done, is that he has done GIS mapping where he essentially did an overlay of life expectancy on a geographic basis with those different zip codes. And that sort of figure, to me, it's more than just a graph or figure. It's almost like an arty graph, where it's a composition of both scientific and artwork, where you develop something in that form that can be very powerful in displaying your message. But that's essentially what GIS mapping is. And I'm sorry I can't give more detail in terms of what's involved in that, just because I don't have a lot of experience in it. But if you still have gaps in your knowledge or database after completing these steps of both doing a literary review and conducting different interviews and surveys or forums within your target population, then it may be time for you to take a more group approach in terms of how you're going to collect your data to kind of address your problems for your knowledge base. So for here, this is something that I took from the RAND Institute. It's designed for more of a group approach for developing these more comprehensive needs assessments, where you're working on more of a group level. But essentially, you're going to need to develop a committee or a work group that is going to essentially allow you to collect data. And since we've already gotten to the point where we looked at what was currently available in terms of assessing the risk and protective factors, we also determined at what data still needs to be collected. This point in terms of determining what is the best method for determining the data collection, this is where it can get a little bit tricky. Sometimes your best data collection is just simply by having group focus groups. And I say simply, but coming up with focus groups where you're collecting information is not an easy task. And oftentimes you need trained professionals to help you gather that information. It could be as simple as developing a health survey or tracking health matrices. It could be as complex as gathering information from medical record systems, like electronic medical record systems. So it really is just going to very much depend on what resources you have available and also what resources you think you need in order to get the best information. The implementation of the data collection plan is generally pretty straightforward once you've gotten to this point. Then of course you want to analyze, interpret it, and then combine it with some of your theoretical frameworks to try to identify some of these priority risks and protective factors, which we kind of discussed a little bit earlier. And then finally, use this information to design an intervention. So next, I just wanted to share some possible data resources that are examples that you can use to get better health data. So Healthy People is a federal program. They have a lot of good health matrices. Youth Risk Behavior Surveillance System. This is going to be something that's sponsored by the CDC. Same thing with the NNDSS. Down below with WHO, UNICEF, World Bank, those are going to be organizations that track a lot of international health matrices. They can also be used domestically as well. Here, I wanted to also list some places where you can find California-specific issues or health matrices with the Kaiser Family Foundation, county health statuses profiles, and then departments of public health centers for health statistics. And before I wrap up here and field some questions, there are a few things that I really wanted to try to hammer home and for closing remarks to kind of tie in what I was speaking about in the beginning and really hammer home the importance of the frameworks and models that are kind of grounding us in our methodologies. And that kind of goes back to, sorry, I'm just kind of flying through this. That goes back to our pre-seed, proceed model and our socio-ecological model, which are really going to not only help inform us in terms of a theoretical framework for identifying some of the causes for a health problem, but it's also going to help direct us in our needs assessment. For example, in your needs assessment, you're going to need to know what sort of state and local laws there are that are going to be both detrimental in terms of making your health problem worse, or potentially state and local laws that may help to try to address it. And the issue may not be that it's public policy, but it could just be where are the funds going and or what community organizations are receiving funding and how those community organizations are using it. And then if you want to design like an intervention on more of a local level, it's important as well. Additionally, I really wanted to come back to this idea of really trying to be a partner with the community that you're trying to affect change in. For my projects that I've done, I've basically always been at this sort of grassroots level. I haven't had much experience in the top down, but I can say from not only a working relationship level in terms of making it a lot easier to develop coalitions and also just develop a good framework for who your stakeholders are. It's really rewarding when you're working with these groups of people. as compared to doing it from a top down model where it's a lot on you. And then lastly, to kind of just wrap us up here, I really wanted to hammer home that a needs assessment is not so different from doing a literary review, which a lot of us have experience in either during our undergraduate years or during our medical school time. That literary review and identifying which articles are going to be more impactful or more persuasive in creating your argument is a skill that I would say that we all have. And I think it's really important to have confidence in yourself and being able to not only identify those important articles, but also come to your own conclusions about them. And then learn how to apply them when you're looking at these data sets for federal, state, and local levels. And then also when you're creating or conducting a forum, survey, or interview, when you identify what information has been essentially unmet or unidentified, this is going to be really, really key. And what I mean by what I mean in terms of the application of this, I'll give you a personal example from this previous year from a project that I was working on. I was essentially brought in to help this organization because I had better knowledge when it came to really delving into the literary research, and I had just more resources being part of a university, having access to those papers. But also it allowed me to understand that after completing that and looking at some of the surveys that they had conducted as a small organization, that we needed to conduct further surveys for their target population to really make a stronger argument. So they had conducted a study showing that people were interested in the program for mental health, but they hadn't done a survey demonstrating that their specific target population had poor mental health. And after we had conducted that secondary survey, that really gave us further backing and also made our needs assessment stronger and demonstrated a more powerful unmet need in that community. And then also, you always want to root your arguments in primary and secondary sources with peer-reviewed literature. It is just so important, and you'd be surprised by how many programs don't necessarily have the resources in order to make those sort of literary reviews, and a lot of the sources that they are citing end up being opinion pieces in newspaper articles, and it just doesn't have the same rigor as a lot of the papers that we read in academia. So with that is the end of my talk today. If anyone has any questions, I'm happy to answer them now.
So I just want to reiterate that community needs assessments are skills. This entire skill set can be transferred into basically any setting. What it's really meaning to do is just figure out if there's a problem, who that problem affects, and how to go about fixing it. That is not just something that you have to do once you're part of some large organization trying to address some large cause for an entire city or nation. That can just be within your majors department, right? That could be within your school of medicine. That could be within your community that you were raised in. That could be within the community that you ultimately seek advanced training in for residency. All of these environments lend to the framework that was just offered here. So I hope that people can understand and know that this is not some way up there, once I get some beautiful degree thing to do. It's something that you can do in your immediate environment. And Reece and I are happy to help support you if you're looking to do an assessment in your community or environment. So if people have questions, The chat box is open. But if not, this is great, Reece. Clear, simple, concise. Love to see it.
Thank you.
For those who are staying on with us, I just want to make sure that you know that the post lecture survey is open. Dropping the link in the chat box here. Be sure to give us feedback on this session. We want to know how we're doing. We want to know what your thoughts are, especially around something that's skills oriented. That's something that we're moving towards in this elective to make this much more skills oriented than just lecturers. And if you're interested in putting this into practice in any way, just let us know. But thanks for being with us, Reece.
Thanks for having me tonight. Looking forward to the rest of the elective.